Just to follow up on your comments, Mr. Hernandez, how much is the overspend on the contract so far? You've referenced it a couple of times.
Yeah, we have, and as you can imagine, that's not a figure that is commercially sensitive, and it would be something that I couldn't discuss in public. But because it has, as a listed company, it has implications. So I'll be happy to have a more private discussion, or maybe write privately to the chairman on this when the moment arrives.
I'd be very interested because I know Mr. Holroyd mentioned progress, but I don't really understand what the progress is. From where I see it, it feels like you're going backwards, not forwards. I may have misunderstood from the reams of numbers that were given, but if you look just at what you define as the most pressing and urgent cases, bereavement, ill health, those numbers are going up, not down. And I have a case of a constituent who died at the weekend that's been trying to get a response from Capita since January. I raised it over a month ago and I've had no response. So how are they urgent and priority cases if even an MP representing a terminally ill constituent doesn't even get a reply?
I can only apologise.
We don't want you to apologise.
I do understand,
explain.
but I want to lead with an apology because it's simply not good enough.
Yeah.
Now I'm going to tell you what is it that we're doing. Chris mentioned earlier we have a triage system, and it's a triage system that we define with the search team from Second Permanent Secretary. The whole set of steps, what are we going to do, how are we going to do it, what are we going to triage, how are we going to go and do that. Then we have invested in recovering what we fell short on the automations, because while I can mention the backlog, the complexity, the data issues, I also have to be honest and say we fell short on getting the automations on time. And this is important because the automations give us the throughput and the ability to deal with these urgent and vulnerable cases also a lot faster. To a statement you made earlier, what is different now? I think we've gone from a system that was in distress to a system that now, in the first half of the year, had a capacity problem, or to a system where we now have a backlog problem. So I think it's been stabilised. We've got the capacity as the numbers that Second Permanent Secretary just shared this morning, which we 100% aligned. The problem is now we need to use that capacity for the next few months to just go and process as many cases, the urgent cases first. And we've actually made, in the last couple of weeks, we made tremendous progress, and the numbers have gone in many areas, all going in the right direction. So we can write to you with some more specific data to prove to you that we're moving forward and not backwards.
Hey, and presumably this surge team, though, that's being funded by Capita, or is it being funded by the government?
Well, we never intended, in the first place, we never intended to have a search team.
No, I know, but is it being funded by the government or Capita?
I made an offer to a commitment to the Paymaster General, the Minister, the Cabinet Office, that we would start picking it up from April. And we haven't had a commercial discussion.
Stop you there, Adolfo. I don't know whether you were listening to I think you were listening to the previous hearing. The Minister said that was completely unacceptable, that you had got to pick up the entire bill of the Surge T from the 2nd of February when it started.
I heard him saying that. We haven't had that conversation yet. I made an offer.
Well, surely it would be reasonable for this committee that you make a commitment this morning, because considering the government was good enough to put that surge team in, and as you heard me thank the surge team, the whole situation would have been far worse without the surge team.
I would agree.
But can you make a commitment this morning on behalf of Capita that you will pay from the 2nd of February? That seems to me only reasonable.
I think there are a number of variables here.
I don't want flannel. I want a commitment. You are the Chief Executive Officer of Capita. You are in a position to make that decision. Will you give that commitment to this committee this afternoon?
if I can just say, there is a lot of decisions that need to be made, and there's no isolated decisions. There are decisions that pertain to this particular investment. There are decisions about others. I think we need to have a commercial discussion, put them all together. I hear you loud and clear. I heard the Minister loud and clear. I heard the Permanent Secretary loud and clear. I know what's been asked of us. When we sit around the table, this will be taken favourably, but we haven't sat around the table. It would be a little bit irresponsible for me to make a commitment before I have...
I don't think it would be irresponsible at all. I think it would be the right thing to do. But anyway, I hear what you say. Yeah. I think it's an appalling reply, I have to say.
Yeah.
I'm sorry for that.
Yeah.
You know, could I respond?
Of course, yes, Catherine.
I was going to ask that question because you're talking about recognition of the reputational damage, not to mention the damage to people's lives. Therefore, that's why I asked about the overspend as well, because I think Capita needs to pick up the ticket here for the failure to deliver on what was promised. And no matter how much you explain how difficult it is and how complex the contract is that you took on, you made a commitment, you haven't delivered on it. And I think to pick up the bill for that rather than the taxpayer would be one way of making some amends for this mess. The other way I think you could immediately help would be to be able to enable MPs to be able to escalate concerns. I don't want any more constituents who are dying to not be able to even help them. And that's a position you have put us in, not to mention our constituents.
Totally fair, and this is something
and I've not had it with any organisation. People answer their MPs when they represent their constituents, but Capita doesn't.
We noticed that we were falling short in that domain. I think it was around April. We didn't have to have a lot of debate. We figured out what was the best possible way to do that. We resourced a team to go under those sessions. Speaking of memory, Chris will correct me, I think we've done nearly 300 drop-in sessions working with the Cabinet Office, and we have another 150 scheduled to happen in July, and we will do more and better. We've also learned the first few ones were not up to scratch. There was more detailed information. There was a request clearly from case handlers that we needed to just be more specific, use a different language that wasn't as technical. So we are listening to the feedback, we are engaging, we've done more, and we will continue to do more. And if we don't raise the bar good enough, I'd love to have the opportunity to hear from you and improve it again.
Or you will.
You will be hearing from us, yeah.
Could I just go on to these bereavement cases, Adolfo? When you took over, I think the number of and bearing in mind these are the most sensitive cases, as Catherine has said. It's, you know, if somebody's dying and they can't get the money they're entitled to, this is really, really sensitive cases. I think you took over about 15,000 cases, such cases. Today, I think there are about 4,300 being processed and about another 3,700 waiting for information. So it seems to me that you're not really making the inroads quick enough into this most sensitive of categories. What do you intend to do about it? And by the way, you put the deadline back from March to May for this most sensitive of categories. That's appalling, isn't it?
I absolutely and I will continue to apologise for people waiting longer than they should. We have deployed a new piece of technology in the last couple of weeks, and in the first week of July we have closed over 1,000 of those cases, and we will continue to close those cases as fast as possible. The rectification plan, as discussed in the previous evidence, will include a very clear and measurable plan to make sure that we close down all those cases and get within SLA on that.
Let's just try and get something out of this session this afternoon. When, in the case of bereavement cases, will you get to your service level agreement? We are going to close out all of those cases that are with us and workable in the next 2 months, and then we will but we are, and as I said, in the last week we've already closed well over 1,000 cases, and we will continue to do so. There are
a number of data and member record and other issues in there that we will work through, and we are currently making sure that we do all those as fast as possible, but they are a tiny bit more complicated. I would also add that we at no point would ever not follow the process as set out, so that it is a complicated process, and we will continue to make sure we follow all the rules in that process, so we're not taking any shortcuts, and we're making sure we do these cases properly.
Of the workable cases, which I assume means you have proper data, they will be sorted within 2 months.
Yes.
Correct?
Yes.
Good.
What's your percentage breakdown?
Sorry, of workable and unworkable?
Yeah.
On death in service, 218 are workable, and there are 618 outstanding. And for the ones that aren't workable, we are working with the task force to go through and make sure that we either receive the documents in or fix the underlying data problem, underlying member record issues. So we don't not work on the unworkable ones. We are actively managing them, but it is there are dependencies, which means that we can't control when they will become workable. As soon as they become workable, we work them as fast as possible.
About a third.
Sorry?
About a third.
Yes.
So you narrowed the category to death in service there. I was talking about bereavement cases in general.
I apologise.
And does the commitment that all those bereavement cases in general will be sorted out, the workable ones, within 2 months?
Yes, and if you would like, I'd give you the same numbers on that. So of the 4,500 that Angela talked about in the previous session that are available to process, 1,465 are workable. The others we are working on either the data or the documentation.
And what about ill health in retirement?
It is 360 workable out of 429.